move my lip, and it doesn't feel like it's like there's a block of cement right there.
Right.
Like I can feel it.
Yeah.
There's just a slight sting. I honestly think it's just the Moab.
Yeah.
But
So tell me again about what was going on. So back last year, what started happening?
I had to have a wisdom tooth removed that was very deep.
Yeah.
And after the surgery, the procedure, I had some numbness, and they said it would go away. Time went by, went on. It did not go away. And then it seemed to just intensify in this area right here, and just every day burn and ache, and just my mouth was numb, but yet it hurt a lot. And it
On a pain level of 0 to 10, what would you say the pain was?
Gosh, there are times in the day that it would be close to 10, but it was always at least 5, if 6. So it was something that affected my life hugely throughout my days.
Right. And so when you went to ask the doctor about it, what did they say?
He just said he didn't know, and that it should get better, and that maybe the nerve just had a little trauma to it. And then after a while, he just said he didn't know, so I quit asking, you know, and just thought, well, I'm just going to have to deal with it. And then midway through the year, 6-7 months later, I called him again, and I said, I can't live this way. He referred me to a doctor in Dallas who only wanted me to take gabapentin and Neurontin.
Right.
And I didn't want to take that. I didn't think that it would help me. I'm a nurse, and so I know what Neurontin is. After several months, I decided I'll go ahead and give it a try, because I was at the end of my rope. I did take it for 1 month. It was awful. It was horrible. All it did was make me dizzy and make me feel like I was out of touch.
Right.
Being a nurse, I cannot be in that state to do my job or to just live.
Right.
So
and not just a nurse, but a critical care nurse. Right?
Yes, sir. Yes, sir. So, and I know that patients that I know are somewhat addicted to the drug, and I was not going to do that. So I did my little trial for them, because I thought maybe if I did that, they would do something more.
Right.
It didn't change anything.
Yeah.
So.
And so I don't remember if you contacted me or I just read about this on Facebook, but you somehow I became aware of this, what it sounds like, we want to call a neuropathy, and I told you to try the Moab. What was your experience with that?
When you told me to use the Moab, that at least helped somewhat.
Right.
Didn't take it away. It didn't make it go away completely, but it helped tremendously. I would just use it every day, and it just took the pain down.
Right.
I'm afraid it didn't take it away, but it helped so much.
Yeah.
So when I found out you had this, and I was so excited, and now it burns a little bit right here, because I've applied a lot of Moab just now.
Right.
And so there's that little sting that comes with it.
Yeah, that's from the capsaicin.
that sort of Bengay feel, if you will.
Right.
But I can move my face when it's felt like there has just been like cement there. Like it was just stuck.
Right.
And it burned, and it's a little stiff, but I can feel it better than I have felt it in over a year.
Awesome.
Over a year.
And so my hypothesis, on these pain syndromes, these chronic pain syndromes, is that it's the immune system response to a localized infection. And so, of course, what the Moab does is it kills critters. Obviously, it was not, so it would blunt or take the immune system response down, producing those cytokines some, but it wasn't enough. And so once we started treating people with the laser, I realized that this combination of effect of what the laser does, which is producing the nitric oxide and dilating the blood vessels to wash things out and adding some extra energy in, that combined with the critter killing, has just been miraculous, right? And so we did a 5-minute treatment on Catherine with the class 4 laser, and took her pain away that she's had for a year. Huh? Yeah.
Amazing.
Yeah.
Yes, I feel like I can move my lip.
Yeah.
So, thank you, Roby.
Oh, you're welcome. You're welcome.
Okay.